Okay, welcome everyone, and thank you so much for joining us on part 2 of our webinar, Community Engagement at Health Centers, Best Practices for Outreach, Advocacy, and Organizing with Patients Experiencing Homelessness. I'm Alex Harris, and I work for the National Association of Community Health Centers in the Grassroots Advocacy Department, and I focus on methods and different ways that we can work to engage our special populations at health centers in grassroots advocacy and civic engagement. And I'm really excited to be working with the National Council for Healthcare for the Homeless, and I've got 2 of my colleagues there with me today, Matt Warfield and Catherine Kavanaugh, who have been co-hosting this webinar series. So we're really excited. We have a couple of really great speakers for you guys from 2 amazing health centers who have a lot of best practices and ideas to share about their work organizing the communities around their health centers, but also some of the things that they're passionate and excited about in terms of this work too. Just a couple of housekeeping things. Everyone on this webinar is muted automatically, and that's because when we don't do that, we tend to get a lot of background noise. And it's difficult to hear, so we keep everyone muted. But if you do have a question, we would love to hear it. In fact, we budgeted a decent amount of time into this hour-long webinar for you guys to ask your questions, whether it's a comment or a suggestion for a discussion point, anything like that. Please let us know. The way that you can do that is in the chat box that you should see at the right bottom corner of your screen. If you don't, there's an icon at the top right that you can click that says chat, which will open that up, but you should be able to see that chat box. And you can either send us a question privately, or you can send it to everyone in the group. So if you want to get a discussion going among all of the attendees, we've got a bunch of attendees from all over different health centers and primary care associations across the country. So feel free to open it up to your colleagues as well, and we'll take questions from the chat box. And then if you have a question that you would like to speak to on the phone live, then please let us know your name and that you would like to ask that question live, and we'll unmute you individually, or we'll try to. Sometimes we have some technical issues, but we'll do our best. So all that said, please use the chat box to communicate your questions and objects for discussion. We want everybody to play a role in this webinar. So just going to go over our agenda really quickly. As I said, I'm Alex, and I'm going to give you guys a little bit of very brief overview of what we do at NACHC in the Grassroots Advocacy Department, and some of the things we've learned from the health centers we work with on some best practices for advocacy and really engaging patients and staff too, of course, in advocacy, and how those 2 things are very different, and how some of those health centers have been successful. Then we'll go to Gary Cobb, who works for Central City Concern in Portland, Oregon, and then we'll go to Vanessa Bora, who's the community organizer for healthcare for the homeless in Baltimore. You'll hear more from them, and then, like I said, we budgeted a decent amount of time for questions, so definitely be thinking about your questions. So just briefly, I'm not going to go through all these stats because you guys have seen a lot of them, but health centers are the healthcare home for over 24 million Americans, and a lot of those folks are from vulnerable or special populations. And so the people that we see at health centers have a lot of different needs and a lot of different life situations that they're dealing with. And I think when we're conducting advocacy and when we're thinking about engaging folks in different parts of the health center system, it's important to consider all of those sort of different situations, definitely many more than we could fit on the screen, and how you use that to message and effectively communicate with them and get them involved. So we get a lot of, sometimes there's like a little bit of fear with the word advocacy, because obviously, we receive a grant. Health centers receive federal grants, and it's important to be careful about how you allocate your money. But I think advocacy is really a broader term than just the legislative sort of legal sense of advocacy that we think about. And I like this definition from the World Health Organization that defines it as a combination of individual and social actions designed to gain political commitment, policy support, social acceptance, and system support for a particular health goal or program. It's really a broad definition to really gain support and build the knowledge base around what a health center is and what the issues in the community are. I think everyone has a role to play, even patients and consumers. we've seen at NACHC as our federal funding has gone up, so obviously has the number of people we're able to serve, but also has the number of people who have defined themselves as advocates. And so we think it's really important to continue to increase the number of people who are excited about health centers or excited about, some of the issues going on in their community and can speak to the value of the health center program. And advocacy is good for our health. I think it's really important to think, not think about asking consumers to be engaged in advocacy is really putting another burden on them, but giving them more opportunity and more options and more information, because I really think giving more information is really powerful. And I actually, there have been a few studies that have shown the power of storytelling. And I found one recently that actually divided a group of people with high blood pressure who were already on some sort of medication but had difficulty managing their pressure into two groups. And one, they gave an extra medication, and then the other, they had some storytelling time to talk with their peers about what was going on in their lives and share some of the stressors that they were experiencing. And the group that told their story on a regular basis actually controlled their blood pressure better than the group that was taking the extra medication. So it actually really has a physical effect on your health, and what are health centers if not promoters of health and well-being. So a few promising practices we found for creating a really inclusive culture of advocacy from the health centers that we know do really well. First, they stay informed. The people that work at the health center, the leadership, the advocacy coordinators, they keep informed about what's going on. These are all of our sort of NACHC ways that you can stay informed. We have social media, we have Spanish and English emails. Now we have text in English and Spanish. So hopefully a variety of ways for you to receive communication in the way that works best for you. But I also obviously encourage you to stay in tune with other organizations that work on issues that are important to you, including your state primary care association, as well as the council and other organizations that you follow. And then from there, it's really a process, in terms of creating this culture. You have to ask the leadership to make a commitment. If you're leadership on the phone, then that's awesome. If you're not, then go to them and ask that this be a priority for your organization. You have to decide on your goals and what sort of challenges you're going to face and really create a concrete plan of action with some of those measurable goals. And then I think it's important to have a space for community feedback so you can figure out, if your advocacy is successful, if people are responding to your messages, if people want to be engaged. And give them a chance to voice their opinion, and then that's going to obviously reshape your plan. We never have a plan at NACHC in our advocacy department that stays the same for an extended period of time, because we are always open to feedback, and we always try to tweak our plan and really create better and better ideas for advocacy campaigns based on what we hear from the field. So I think you really, it's important to think about the issues you want to explore. Obviously, in NACHC, we deal with federal issues. Your state primary care associations will deal with state issues. I think health centers have a really big opportunity to be working on local issues. But at the end of the day, I think honestly, wherever you start, whatever issues you start with, as long as it's something meaningful for your patients and you're communicating it in a way that really gets them engaged and makes them feel like their voice really is powerful and they can have an impact at some level. The more you do that, the more advocacy you do, the more campaigns you do, the more your patients are hearing from you about this kind of stuff, the easier it's going to be in the long run, and the more fluid it's going to become. Obviously, considering, the health centers know better than anyone the characteristics of your community, the patients that you serve, in terms of immigration status, what technology people are comfortable with, how isolated, is it a rural or urban environment. The political environment is huge, language and dialect. There's so many things to consider that you guys already, by working at the health center, pretty well. So I just suggest, whatever you do, always take that into consideration. I think we provide a lot of templates, for example, at NACHC that we try to use, give to you as sort of a resource, but we highly, highly encourage you to rethink sort of, those stuff that we put out there and frame it in a way that works for your community, or even recreate it if that's easier. because we certainly want everything you do to be working for the people that you're trying to engage. And then obviously there are different considerations like what tools you use to communicate with people about your advocacy efforts, what message you want to give to them. You know, you might not want to scare them with, you know, a huge loss of funding around the corner, but you might want to encourage them with some sense of urgency in some way. So thinking about balancing that message is important. Obviously, language is huge. And then, you know, what action steps do you want people to take? Like, what are people comfortable doing? I think it's, you know, sometimes can be kind of sad when you give somebody a really big issue and then you don't give them, you know, an action step, something to do. So you say, you know, hey, you know, we've got this big issue our health center is dealing with. We might have to close the site. And then, you know, the patient's like, well, what can I do about it? So always, I think, having something for somebody to do, but something that's, you know, it doesn't necessarily have to be easy, but something you think they're going to be comfortable doing. So just, you know, definitely check out our website. We have a decent amount of resources on there. We have board committee bylaws and descriptions for advocacy coordinators. We have social media stuff. We have videos and sign-up forms and fact sheets. A ton of things, you know, you can navigate through. If you can't find it on our website, please email me and let me know. And if we don't have it already, we'll take that as feedback for something we should be creating soon. So don't be hesitant to reach out. And at the end of the day, you know, we're really looking at, you know, and that from the NACHC standpoint, in terms of advocacy, we're really looking to build up the power that we have. We don't, you know, we're not so concerned with the number of people we have, you know, as quote-unquote advocates. And we're not so concerned with all the little, you know, pieces of legislation here and there that may pass or may not pass. What we're really concerned is the big picture, making sure people are excited and motivated and interested in what health centers do and how they do it, and they can speak to it, and people just are a part of the movement. We're really trying to build a movement here and keep it going. So that's what we're looking to, and I think our two speakers are going to speak really well to some of the ways that they found to be effective in terms of engaging the consumers at their health centers to really create some positive change on a multitude of levels. So with that, I'm going to cut my part, and I'm going to, you know, if you guys have any questions, I'm happy to take them closer to the end, but you can feel free to go ahead and put them in the chat box. But I am going to pass it over now to Gary Cobb, who I mentioned works with Central City Concern out in Portland, Oregon. He's their community outreach coordinator. And we're really excited to have him on the line. So thanks, Gary.
Okay, so greetings all. Thank you, Alex and Matt and everybody for inviting me to participate as a panelist here. I think you said a lot of great things in that introduction, Alex, and it is partly, sometimes at the end of the day, it's not about the wins, but in this advocacy, how do we build and strengthen our community with one another? So a little bit about me. I came to Central City Concern in 2000, seeking services. Prior to that, 1982, when I got out of the Coast Guard, I was pretty much unhoused and addicted to drugs and lived that life pretty much that whole time until I got into services here at CCC. The services are really valuable. I had not experienced a clinical setting that had all these wraparound services, that had housing, had you know, healthcare component to it, the addictions and mental health services that attached to it, as well as having an opportunity to, at the end of our continuum of care, we have an employment access center that helps people get back into a workspace. And so I started working as a janitor in 2001 at our clinic, and as time moved along in that first year, I started doing some community organizing training, and it became pretty clear to me that that was something that I felt that I could really attach myself to. It had a lot of meaning to it. It was very purposeful, and at the heart of our agency, it was pretty clear that from the leadership, the board of directors, and on down to line staff, that community organizing and storytelling was really an integral part of the character makeup of the agency as a whole. So that was pretty comforting. It wasn't, I didn't have to, like, you know, force a lot of buy-in about what we were doing. And so over the years, we've kind of professionalized my position as an organizer a little bit more, and we've created a bigger policy team. I report to our policy director, Rachel Post, and we have just a direct line of communications with our executive leadership team. So that makes getting all the go-ahead to do advocacy work, be it at a federal, state, and more local city or county level, which is kind of, we're in the middle of the process right now. I'll explain a little bit more about that. But having all that kind of collective buy-in has made my job a little bit easier, and I have access to our the different programs, and you know, I'm around constantly, so people are used to seeing me around, so nobody's surprised if I am able to ask if I can speak with them, possibly to hear their story. So maybe you can go to the next slide, or do I have control of that?
I think you can, but I'll go ahead and flip it.
Let me see here. I don't see. Okay, I got it. Let's see here. It's not doing it. For some reason, I'm not be able to move the slides.
All right, let me just try it for you. Hold on.
Yeah. Oh, there we go. So a little bit about who and what CCC is. This is kind of our snapshot, the kind of opening slide of our PowerPoint that we always show when we're doing tours. And when it gets down to that middle of who we are, of the 46% of our employees self-identify being in recovery, and then 25%, like myself, who have used our programs, that allows a lot of conversation about what folks are needing, and kind of how we are always trying to be at the forefront of kind of meeting people where they're at. That said, we have close to 800 employees now, so we're getting bigger and bigger as we move along, and there's some growing pains in that, but at the same time, we're able to manage and adhere to our core concept that stories are still at the heart of what we're doing here. So I still have a lot of freedom to approach different departments. So we have a detoxification center. People can get into our outpatient addictions treatment program. We have over 1,600 units of housing. We have a integrated mental health and substance use disorder clinic embedded within our primary care clinic. That said, is that wherever stories may need to be told at in any of those areas, around housing, around substance use disorders, around mental health, around primary care, that it's just like everything's very available for me to go and meet with providers and find out, identify storytellers, people that might want to tell their story. And people generally do want to tell their story after I meet with them. So there's a process that we have built in and around some trainings, and I make sure that folks have a little understanding, kind of the pathway that I've taken, and a lot of times it's pretty similar, the journey that they're on. So it really helps to have that initial lived experience for me to build that relationship process. So can I go to the next slide, please? So is there any questions or about anything that I said, or we want me to just jump into these sample questions that were there?
Yeah, let's go ahead and jump in. I don't see anything in the chat box, but just a reminder, if you do have a question, go ahead and type it in.
Yeah. So just kind of coming from the questions that were presented, this one, why is it important for health centers to be engaging consumers in advocacy work? It was mentioned earlier in Alex's introduction that it is very therapeutic, and it's very empowering when folks are finally, maybe for one of the first times in their life, having their voice regarding where they're at, what they want, what they don't want. And it's really, I can't, you know, when I see people really share their story, it's so, there's nothing that can explain that type of feeling to see people totally engage. It's very cool to say that. So other reasons why it's good too is, you know, it helps agencies like ours to secure funding. And so an example is we're in the middle of the budget process here in the city of Portland. So there's a city of Portland budget hearings going on. Went to a housing bureau hearing last night to hear the kind of like the lay of the land, and then we have 2 to 3 more opportunities to take folks in to testify in regards to some housing services. Same thing on the county. The Multnomah County is going through their budget process. So in doing all this work, my job is to help identify when these hearings are going on, and also you have to understand where these different entities, what do they fund? And so the city primarily funds like some employment services and housing services. The county will fund some mental health, some addictions treatment, and our detoxification services. So when I'm taking people to whatever it may be, whatever city or county or even state, I have to help them understand where their story fits in and how is it connected to the program they may be connected to. So really not just saying, oh, go tell your story here, but really educating them and letting them understand how all this process works and why they're talking to these people, why is their story important within the department that is funded by whatever entity it is. So it's really important to try to inform and educate folks about how the process is working without it being overwhelming. And of course, kind of the last bullet point here is that find that elected officials really want to hear these stories. I mean, we'll follow that up with a tag team of maybe one of our executive leadership team members will go present some numbers to them. And that's one thing, but the stories are really, really powerful in this process. So, next slide, please. Okay. So the other question, how do you engage consumers in advocacy work? And this really, it starts with building these true, authentic relationships. And I mentioned that I've came through services here, so I have a little bit of buy-in with folks when I'm talking with them, and I'll share with them that, you know, that I won't ask anybody to do something that I haven't done myself, and that in this process that I'm right next with them as we're going to do this experience, and really not make it, it can be very overwhelming at first, and you know, a lot of things happen to people when they're testifying in a 3-minute setting. You know, it happens for me too. It's like as I'm telling the story where I'm at today, simultaneously all the stuff that I've been through in my life kind of runs through my brain as I'm sharing the story where I'm at today, and it's kind of it can be super tiring and draining, but and part of our training processes and part of all these experiences, we always do an evaluation at the end of an event, and I'll talk a little bit more about that. So, you know, in the course of building relationships, I attend a lot of the alumni groups on a monthly basis, go to graduations, and there's a couple advisory councils that we have internally here, our Health Services Advisory Council, and we have another advisory council we're developing with our Latino group. And in addition to the consumer relationship building, I'm keeping that going with the staff. I have to have a equally powerful relationship connection with the staff, so I can, let them know what's going on, especially if I may be partnering in an event that could be some of their consumers in one of their programs. Okay, next slide, please. So this question, how does the organization support consumer engagement and advocacy? Staff time, educational opportunities, and resources need to be made available. So I'm employed here to do community outreach and community organizing, and work pretty closely with our policy director, as I mentioned before. Then we have our communications team, which is a big support on all this. I think that it takes a minute or two to really get this going, but because I've been here 15 years, and when I first started, Central City Concern was part of bigger, broad-based coalitions and organizations out in the community, churches and other nonprofits, and so that's where a lot of the initial training ground for me came into it. As the years went on, some of those broad-based coalitions have kind of went away, but we've tried to keep our integrity with trying to do internally here. So there's updates. We have our board and our board of directors involved in this leadership development. We open up the trainings not only to the consumers but to staff as well. And last night when we went to this Portland Housing Bureau meeting, there's probably 5 to 7 staff from different parts of the agency and different clinical programs, and then we probably had another 5 to 7 consumers. So, it's usually when we're fortunate enough, there's like I said, we have a large body for me to draw stories from. So when we go to one of these events, we go pretty deep. So let's see, next slide. So there are challenges to doing this work. A lot of times how events go down with government organizations, or city, the county, they are after hours. So the event we went to last night was from 5 to 7. So it's one thing for staff that are involved in this. It's always a kind of a balance. How do we honor people's time? So we try to make sure that people get food and that they have their transportation needs are met, and we really try to honor that. And the key to all this, if somebody can't make it, and there's no pressure on that. It's really important. Folks have already gone through a lot of stuff in their lives just to come through our doors. We don't want them to come in our doors and supply any other pressure to them. So, these things here are really the kind of the lay of the land. Sometimes we'll get a notice like, oh, there's a hearing. It'll be tomorrow night. So a lot of times it's less than 24 hours notice. Some people may need child care, and sometimes that's a real, just on good days, that's a hard thing to navigate. So we're always mindful about when we're telling some of the family stories, what does that look like? How do we support that family? And then transportation is always an issue. Luckily, a lot of times in our downtown, the city hall, like last night was a short walk, so I was able just to walk with a group of people up to the Housing Bureau office. Okay, next slide, please. And kind of like the first question, what are the benefits to consumer engagement and advocacy work? You know, it really does. It's been spoken to. I think and when it contributes to personal growth and the gift development, I've always said that through our trainings and creating other organizers, I could, you know, it doesn't matter to me if they stick around here and help us tell the Central City Concern story, their story, the Community Health Center story. That'd be great, but if wherever they go in the world, if they can retain that organizing spirit, wherever they do it, that's great if they continue on with that. I think that's one of the best things that we can do for folks. So, you know, I've seen the health piece. People seemingly be healthier after they got involved in doing this advocacy work. I see it monthly in our Health Services Advisory Council, and how people become these leaders, or they may be slightly kind of at the table but maybe not engaged, and then a few months later you see them really adding their voice to the conversation, and to see kind of their eyes light up, and you know, people paying attention to them. It's really, really awesome. Other benefits, as you can read here, I think the civic engagement, and I think this process we're doing here on these webinars lends the broader, puts the light on how important health centers are, not only with the services that they provide, but what they're doing to their community around them. It's really engaging the community, makes the community whole. So see that happening, and I think that's a powerful thing that we have to continue helping do here. Again, you know, it helps highlight the work that Central City Concern does and supports our mission statement. See, I think there's another slide, right? Yes, and so again, in part of this process, how do you empower consumers to define how they want to be using their voice and engage with issues that are important and meaningful to them? It goes right back to the beginning. Hi, my name's Gary, you know, and sit down with them, ask them if they have a minute or two just to chat, you know, ask them about their experience that they've had at the clinic. And, you know, when you kind of start that, then you can build out about, you know, talk about like how has it been difficult for you to get into clinical services in the past. We have to kind of learn from our history here to keep pushing forward on the future, you know, and really build on, you know, what is working currently for folks. And they're the ones that know. I mean, I have an idea what's happening, but until I sit down and hear from them, then I'm usually pleasantly surprised. So I think the piece and how meaningful it is, it's still yet to be seen. But you know, people know this time of year, and I you know, like starting usually in March and April, people will say, hey, is there any budget hearings that are happening? And these are people that may have went 2 or 3 years ago to an event, and you know, it's pretty cool, and it makes me feel really proud that to be at an organization and be connected to all this, that we're trying to help make a difference in folks' lives and giving them that voice. Because I can remember when I didn't have a voice for way too many years, and so again, I feel very fortunate to have a position that allows me to do the work I get to do, and I think it's the best job in the world for that matter. you know, another piece to this is how do you find the way to honor people in doing it? We usually, after an event, I'll go back and I'll meet with people and I'll give them a cup, and it's a coffee cup, and on one side it says Central City Concern, and then on the other side it says My Story Matters. And I've heard countless stories where people will be somewhere with that coffee mug and someone will say, hey, what does that mean? And they'll tell them their story and tell them the story of advocacy. So it's kind of this cool thing that keeps on giving here. So I think, is there another slide? Yep. So this is kind of part of our thought process here at CCC, and this is something that we share when out of our policy department here. And folks can just kind of read it. I'm not going to read it to you. I think that it's super important that we honor people in a way that is meaningful to them, not what we might think is meaningful. You know, and always be, I guess, in part of this process too, being super careful about, you know, always let people know what's happening in the regards of, you know, hey, your story might be out there on the, you know, the World Wide Web, and think about like what you're trying to do with your future here, and be very clear, not only the, you know, where your story can end up, and also going to an event, we have to make sure that that media may be there. And I've been burnt by the media before. Well, people will testify and tell this awesome story of how the services work for them, how their lives are so much better as a direct result of using a health center. And then the media person will come up, and what happened to me was that she said, hey, so that was a great story. So glad that you're in recovery. So tell me, what was one of the worst things that you did out there in your addiction? And so the thing on that is that people are so proud of where they are today, they have no problem saying something like this bad thing because they know that that's not who they are. However, that's what gets printed, is this bad thing, and it's really unfortunate that sometimes that happens. So we are very protective when we go to an event. We have a couple of spotters in the room looking for the media, and so if we see a media person kind of honing in on somebody, we try to find a way to be protective of that person. So you got to watch out for that type of thing. So I think kind of it for my slides, and I think I covered our process there. So.
Thank you so much, Gary. We really appreciate it.
Thank you. I'm sorry if I went over time.
No, that's okay. I think we should have some time left still for questions and everything, but we'll move on to our next.
Okay, thanks so much, Gary and Alex. So next up we have Vanessa Borotz, who is a community organizer with Healthcare for the Homeless in Baltimore. So Vanessa, if you want to go ahead and take it away.
Sure. Good afternoon, everybody. So I'm going to talk a little bit about our work here in Baltimore with consumer engagement and advocacy. So here in Baltimore, we sort of, a value of our clinic is the integration of service and advocacy, and the ways that we support consumer engagement in both of those is through our Healthcare for the Homeless Consumer Relations Committee, which is more internally focused and providing feedback on the patient experience to inform service delivery and participation internally in our agency. And then as well through advocacy in developing our advocacy agenda, and through an advocacy group, Be More Housing for All, which is more externally focused, where again, as Gary mentioned, we help people connect their personal stories to the systemic issues and have a space for people to share and talk about issues that matter to them. And again, this Be More Housing for All advocacy group also is an incubator for a lot of external advocacy in Baltimore related to homelessness. So this is just a diagram to kind of show how the two groups are separate, but there's a lot of overlap as well. So the Consumer Relations Committee is it's a committee of our board of directors, but then we have a number of client groups at our clinic that engage clients in a number of ways, from art to writing to stress management, yoga. But client advocacy group is one of those groups, and it's peer facilitated. It's a space for clients to gather and to talk about issues in the broader community. There's this picture from our annual lobby day, and clients are heavily engaged in speaking up and testimony and, involved in our advocacy work. So why do we engage consumers in advocacy? As Gary mentioned, it's obviously very important. Real stories matter when we're talking to elected officials. People just really want to get involved. There's a lot of interest. This is one area that's self-directed. We don't tell people they must get involved, but there's this interest in, people have this desire to help others and give back. Share their experience of homelessness. They find a lot of meaning and purpose in this work, which meets needs that aren't necessarily met through the delivery of service. And also it's just, powerful to use one's voice to advocate. And it's really important that we create that space for them to get involved, regardless of whether it's affecting changes in the local project or more broadly through policy advocacy. And again, there's a lot of positive effects of consumer engagement that I'll talk about later, and Gary mentioned many of them. And we, Oh, shoot. Well, sorry, those pictures are supposed to come in later, but so those are some photos from our Be More Housing for All advocacy work, or advocacy group. It's the brief history of this group. It actually evolved out of a organizing effort in 2007 where people were staying in encampment in Baltimore City and were threatened to be evicted, and folks gathered and organized, and it was a successful campaign. Every, I think, 30 or so people ended up being put up in hotels and were housed. But, after that campaign, there was sort of this awareness of, well, what about everybody else? So Be More Housing for All came to be in existence, and there was, initially people were meeting at multiple service sites, but again, without that healthcare for the homeless, creating that space for people to meet and have a regular place to meet, a lot of the other groups weren't able to continue. So this is just the group's mission as a grassroots campaign who works to promote public policies to make housing affordable, raising awareness of the experience and causes of homelessness, and fostering leadership and solidarity among people experiencing homelessness. So the meetings are every Tuesday from 11:45 to 1, and it's really important that there is this regular place and time for people who lack a lot of stability in their life to come and meet. It's a low barrier group, open membership. It's very dynamic, changes, membership changes. It's also an introduction to advocacy to people who might not know much about it. And it's just a space to have discussion, to foster relationships, leadership, a way to plug into various activities. And again, we'll get into more, but it's also an incubator of community groups. So this is, again, the diagram and kind of showing how a lot of groups have come out of the Be More Housing for All advocacy group because, again, providing that space for people to meet and talk about issues and kind of coming up with, well, what are other ways that we can, engage the community broadly around raising awareness and advocating for change. So the Faces of Homelessness Speakers Bureau is actually how I came to Baltimore initially as a coordinator of the project, and it is, a collaborative effort among various service providers locally, initially sponsored by the National Coalition for the Homeless, but has really taken on and is still, still an independent organization led by leaders who, initially got engaged through Be More Housing for All. And, they go out and speak to the community about homelessness, and they share their story to a variety of audiences, and it's a really powerful group that is led by people with direct experience. We're on the Street is another group, a public education newspaper that came out of Be More Housing for All, and is currently in hiatus because of capacity issues. But again, it's like, people have a desire to share stories and educate the broader community. Move on. Housing Our Neighbors, again, is another group that is that meets twice a month, and they do a lot of, they came out of an annual sleep out event during Hunger and Homelessness Awareness Week, that they advocate for the right to housing through direct action, public education, political advocacy, and grassroots organizing. And that's another way for people to get involved and deepen their engagement. So this is sort of meant to show how all these groups kind of do something different, but they all work together in a variety of ways, and they obviously have a number of external partners that they engage, whether it be schools, community groups. Housing Our Neighbors also works closely with United Workers, which is another grassroots local group. So there's just a lot of connections that are formed locally by this by healthcare for the homeless, supporting indirectly grassroots community organizing, led by people with direct experience. And this is just to kind of show some of these collaborations. So on the top left is a member of the Speakers Bureau, who is also a member of Housing Our Neighbors, and also a member of the Baltimore Housing Roundtable that's working to bring community land trusts and permanently affordable housing to Baltimore. This is a collaboration with the Speakers Bureau, and we're on the street engaging people on an injustice walk that shows, brings community members who are interested in learning more about homelessness and want to do something. They have an opportunity to learn from people and, engage in the community in that way, and then some public outreach down at the bottom with Housing Our Neighbors and We're on the Street. So a lot of groups working together. And so lessons learned, I won't go deep into this because Gary said a lot of what I was, we're on the same page there, which is a great thing. It's a very engaging, consumers requires a lot of intentionality, whether that's in HCAs or the broader community. It requires a lot of authentic relationship building so that you're ensuring that you have a relationship with someone when something comes up. And you're not just throwing someone into something unprepared, but you're really giving them an opportunity to be truly empowered by the experience of engaging in advocacy, making sure that people have opportunities to connect and deepen their engagement with the issues themselves. There's a lot of benefits that people report. There's sort of this interesting shift from patient-client to advocate-volunteer that really brings a sense of dignity and people's self-directed involvement. They're being told what to do a lot of the time in terms of their care, which, as going to the doctor, that's what happens. But then, if you're getting involved because this is something you're passionate about, it's very empowering, improves self-esteem, strengthens people's social networks, and reduces that internalized oppression or shame or all those baggage from society that people hold on to. Challenges are just limits of time, involvement in multiple groups sometimes can lead to burnout, capacity issues. A lot of these groups are grassroots, so there's not a lot of, a lot of people are doing this on a volunteer basis, and so while sometimes it does lead to employment, which is great, it's, a lot of, it's important to constantly be building new relationships, developing new leaders, and then again, an emphasis on the importance of self-care and community care. So, not just burning yourself out, but really like having a balanced, healthy approach towards advocacy. And I'll end with a quote by Yashna Maya Patamise: "A liberatory care practice is one in which we move beyond self-care into caring for each other. You shouldn't have to do this alone."
That was great. Thanks so much, Vanessa. So just want to remind everyone, if you do have any questions for our panelists, just go ahead and enter them in the chat box. We have a few minutes left here before the end of the hour. So I'm going to go ahead and just start with a question for both Vanessa and Gary. Feel free to answer it. I'm interested to hear if you have like a really standout success story that you can talk about of kind of engaging consumers in advocacy and some really great successes that have come out of that, maybe particular movement on piece of legislation or something locally. We'd love to hear about that.
Take it, Vanessa.
Okay, well, the thing that just jumped to my mind was a particular, person who got involved, a while back, was working almost, like when I say the importance of self-care and community care, it was an advocate that was working around the clock and currently was experiencing homelessness, and was just working like a tireless advocate for the community, and I don't know how he did it, but it was amazing to watch him grow, and now he's an organizer with the Housing Roundtable, the Right to Housing Alliance, which is an organization in Baltimore. And so, it's great to see, like we weren't, I think these connections help, lead people to meaningful, gainful employment, and but really the opportunity to do what folks find meaningful, and I think that's something that I strive for, to create those opportunities. Like, I would love to see this happen more often, because the work that people are doing on a voluntary basis is so meaningful, and it's great when to see somebody now as an organizer doing this work. Yeah.
And we got a couple of questions in the chat box here. I'll go ahead and ask you guys the first one. Do either of you have a community advisory board? And if so, do you have written rules of engagement?
Yes, we have our Health Services Advisory Council, which follows there's bylaws within that, and that mainly, I think, came down from some healthcare for the homeless advisory board stuff that from grants that we have gotten when we started our advisory council. So yes, to that question, and to both those questions in that.
Yeah. So we have we do have a community advisory board, but that's what we call our Consumer Relations Committee, and we have sort of a charter, and we don't have necessarily rules of engagement, but, as a group, we sort of come up with guidelines for, how we want to hold each other accountable and things like that.
Great. And I have another question here. So how do your organizations balance authentic leadership with people who are marginalized and oppressed against the organization demands as service providers, which often have a hierarchical relationship between service providers and recipients, nonprofits, which are often beholden to affluent funders, and membership trade organizations where the members may lack a shared interest or interest with those who are most oppressed. So really just looking at how do you balance some really competing demands and perspectives about the work that you're doing. That's a tough question. Well,
yeah, that's a tough one. It's a good question. I think, again, I laid it out in the beginning, at least for us. Yes, there's that kind of feeling of that dominant piece and that hierarchy thing, but as we've grown over the years, we've also changed the hiring practices and having more folks that had received services over the years, being employed here, creates that almost counterbalances that hierarchy culture. And matter of fact, right now we've developed in the last 2 years what's called an equity and inclusion group, which I happen to be a member of, and that's doing an internal work and really putting pressure on our executive leadership team, saying, hey, you know, we have to start having even more open hiring practices. We need to have employees that reflect of the community that we serve, you know, and trying to change that power dynamic. So it's a work in progress.
Yeah, for us here in Baltimore, that's kind of where there's a limit within what healthcare for the homeless can do, balancing priorities and relationships and things like that. So that's a large reason why there's a lot of external advocacy, a lot of grassroots community groups in order to sort of, make sure that we don't limit the autonomy of clients, that we don't censor them in any way, or like making sure that we provide, authentic leadership development, ensures that people are developing in the way that they want to develop. And so that's just kind of how we watch things grow as people want to be growing. And I don't know, it probably plays into how things develop here in Baltimore.
Great. Any other questions or presenters, any final thoughts you want to share?
I think I'm good. Thanks again for this opportunity.
Great.
Yeah,
well, a big thank you to both of you, Vanessa and Gary, for sharing some of your time and your ideas and your experience with us. Hopefully you guys on the webinar got some good ideas and practices and some great motivation for doing this really important work in your community and at your health center. And I know Matt, Catherine, and myself are all available for any questions you might have as a follow-up, or any feedback or resource requests you have for NAC or the council. We're happy to take that feedback, and we'd love to hear from you about this work. Just so that you know, we are recording this webinar, so we will send out to all of you. Probably it will be next week when the recording is prepared. We'll send you the slides as well as the recording that you can share. And we'll send the recording and the slides from our Part 1 webinar, which took place in February as well, so you guys will have access to that. And please do share those links, share those slides, just spread the word about this work. And again, we'd love to hear any feedback, particularly on these webinars, if this was something you found particularly useful, if you'd like to continue doing something like this, with different topics or different, different particular focuses in the advocacy and civic engagement realm. We'd love to hear that feedback. So thanks again, and I'll open it up to Matt and Catherine if you want to plug anything before we.
I think, no, just thanks so much for putting this together, Alex, and I know we appreciated having this opportunity to talk about advocacy work here at our Healthcare for the Homeless. I just will plug, if you want more information about the National Healthcare for the Homeless Council, you can find us on the web at www.nhchc.org, and a lot of resources there and other information about what we do. But thanks a lot.
Thank you.
Thanks all.
Thanks a lot.